The first NHS Health Check Leadership Forum brought together public health experts to discuss the latest advances in the field, including clever targeting, communicating risk in intuitive ways, and transferring data electronically to patient records. Initial findings from the national evaluation were also presented. Health Diagnostics hosted the event.
Health Diagnostics' mission is essentially to ensure that the NHS health checks that are now being delivered throughout the country get to the most vulnerable groups. And essentially you can do that by having a completely portable unit so that people can go out into the community to actually deliver effectively to those people that wouldn't necessarily go into a GP practice.
I'd just like to take a quick show of hands, because I know that many of you here today are very involved with the implementation of health checks in your various capacities. Among those of you who are, how many of you think that you can conduct a health check out in the community and immediately transfer that data to any GP clinical system that there is, so that it automatically will populate the individual patient record without any manual interference at the GP surgery, other than the GP just clicking accept? How many of you think you can do that?
It's half elevated.
Okay, that's kind of a 1.5.
If we're not getting it back into the GP system, it ain't going to be counted. So the fact is, it's got to be getting in there whatever way, and it's got to be cost effective and without error. It's really important that we can get the health check into a single session. It's about 50% of people don't turn up for a second visit. So if you go to a GP practice and you have to have a venous sample, that's when you have to have a sample taken by what's called a phlebotomist. You have the sample taken from your arm. That goes off to a pathology lab and you have to wait a week for the results. So therefore you can't have all the results and what's called the motivational interviewing session, where you can explain the results all at the same time.
Our model is very much about promoting lifestyle change, behaviour change. So we will focus on things like increasing physical activity, stopping smoking, reducing alcohol consumption, managing weight better, and it's about giving people choice. Our model, again, is about empowerment.
If you can show pictures, people can take in the information in a much clearer way. So with the software that we've actually developed, we've used a lot of visuals to help support an operator going through the process so that they can point out to them, this is your risk. And again, we use slight betting mentality when we come to the risk score, where we say there's a 1 in 3 chance or there's a 1 in 8 chance, because when you use visuals like that, people tend to understand it a little bit better. Used extensively with our clients here is we do the what if scenario. So we show them where they sit as far as their risk is concerned, and then we show them where they would be if they change their habits, and they do it all in a single session.
What we are seeing is, as you see, greater uptake, well, put it this way, lower uptake in the least deprived areas, or the converse of which, greater uptake in more deprived areas. So that is very encouraging.
As a commissioner, we have very sort of big key decisions to make around investing in the IT infrastructure. That's my overriding impression of today, and I'm going to be going away and talking to colleagues and stakeholders about how I can make that happen in my local area.